And Peter Emerson, now Democratic strategist and Huffington Post contributor. We also have Hadley Heath Manning, Director of Policy for the Independent Women's Forum. Great to have you both. And Hadley, what is your reflection on this lawsuit and what it might mean, this ruling?
Right, so it's a complicated legal battle. The House initially filed a lawsuit against the Obama administration for spending money in these cost-sharing reductions that was never appropriated by the Congress that passed the Affordable Care Act, so a previous Congress. Now we have a new Congress and a new White House who are still engaged in a legal battle, but these attorneys general are concerned that neither party really wants to fight for these cost-sharing reductions. About the cost-sharing reductions, I think it's important for people to understand what they are. They are a government solution to a government-created problem. The reason we have high out-of-pocket costs is because when the federal government says insurance plans have to cover A, B, C, D, E, F, G, insurers look for other ways to cut costs, like narrowing networks or increasing out-of-pocket costs on consumers. And
that is just one dynamic of the way the private insurance industry does function here, Peter. What is your reflection on this latest decision?
I noticed very particularly the courts ruled with some economic emphasis that without protection, these states could often be burdened or even bankrupted by having to step in and cover. What's important to remember for everyone is that this debate about health care has been going on since I served in the Carter administration, when health care costs were the second highest part of inflation. And unfortunately, the debate that's going on now really has nothing to do with health care. It has to do with the real attempt to get a tax cut. The Republicans cannot get their tax cut unless they reduce health care costs, which means reducing health care for millions and millions of Americans.
And there are many drivers. That is certainly what appears to be one of them in terms of the benefits that do come from the latest bill from the Senate. Hadley, I want to move on to this question, and that is, if nothing's done, Obamacare on the private side will have great difficulty. There have been many reports that there will be either only one insurer or perhaps potentially even zero insurers in many of the counties across the country. So then what is the step here as we try to move forward?
Right. So I mentioned the cost-sharing reductions are a government solution to a government-created problem. We should go upstream and see what the root cause of that problem is. I want to agree with Peter that the debate right now is not about health care. It's generally more about health insurance and health insurance laws. So what we need to do to address the high cost of insurance coverage for so many millions of Americans is undo many of the harmful regulations that have caused premiums to skyrocket, increasing over 105% since the Affordable Care Act passed.
What would be one that you would look at?
Well, for example, I would allow insurance companies to rate their policies according to age, like they did before the Affordable Care Act. The Affordable Care Act requires insurance companies to charge the youngest consumers about 1/3 of what they charge the oldest consumers. That doesn't reflect the consumption of health care services between the youngest and oldest, and it's part of the reason why you see these pools in the Affordable Care Act's exchanges are really skewed towards older, less healthy enrollees, and it's driving this adverse selection, ultimately a death spiral in the exchanges.
I know you probably have a reaction to that, Peter, on the death spiral, because we've heard that word before. Also, the question, Peter, to you is, would that work, though? Because wasn't the philosophy behind the ACA is that by looking at different sort of subsegments, you'll be able to flatten out your costs and flatten out your revenue?
Well, that was the theory. Let's all agree it's not working as it should, but millions of Americans have health care coverage now that they didn't before. But I also want to refer all of us to a statement made by Kellyanne Conway that if people can't afford Medicaid, they should just get a job. That's the most sort of vile statement I've heard of late. One thing I think that could work very well is if the president, who promised during the campaign to negotiate pharmaceutical costs, got actively engaged. Pharmaceutical costs may be the highest cost of health care at the moment. So
is the president the right person, though, Peter? Is he the right person to engage this topic, your idea? Shouldn't it be Congress?
Well, he made the promise during the campaign that he would negotiate pharmaceutical costs down, so I'm merely holding him to his promise. But yes, of course, at the end of the day, and that was a failure of Obamacare, that the whole issue of pharmaceutical costs was not addressed properly.
Last word to you here, Hadley. Is that an idea that you would agree with?
Well, certainly pharmaceutical costs need to be addressed. I understand Americans pay a great cost for the drugs we consume, some of them because, you know, the research and development costs and the innovation where American companies are at the edge, the tip of the spear in terms of providing new solutions and new cures to some very, very serious diseases. But in regards to what Ms. Conway said, you know, I think we need to get away from an employer-centric health insurance system to begin with. I wouldn't suggest that people need to get a job to get health insurance. Obamacare doubled down on that with the employer mandate, suggesting that employers should be, you know, sort of the provider of health insurance. I think people ought to have the freedom to go purchase plans on their own that suit their own individual needs and preferences and budget. So getting away from the employer centricity of health insurance is going to do a lot to boost competition and ensure better prices.
Peter, do you agree with that? The employer centricity, or is it really instead of maybe going for a 9, do you go for a 5?
Here's the problem, is that ultimately everything that's being proposed right now has a cost. And as your segment before with the former acting Secretary of Labor points out, millions and millions of Americans, not poor people, middle-class Americans, don't have the money. There's an extraordinary segment in Senator Al Franken's new book about a family that had to choose between food and medicine for one of their children. That's unacceptable in America today.
All right. Peter Emerson, Hadley, Heath, Manning, thank you. Spirited conversation. Appreciate it.